we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like Hawk. Okay, welcome back again this week. We are doing the second part of the trilogy of pregnancy, 2.0 baby download. Okay, so today's talk is about the 4 P's of labor. Okay, inside this talk, there'll be a lot of questions. Okay, so you guys stand by on the keyboard, and if you want to answer, you answer yes or answer Y. Okay, because usually this class, I will ask the mothers to hands up, or to just hands up lah, right? But because now we're doing online, you cannot hands up, right? So you just type yes in the chat box. Okay, so okay, are you guys ready? Oh, no one answer. Okay, yes, okay, good, all right. Okay, yeah. Okay, so try not to draw on the screen. Okay, so the manual for today is when to come to hospital, what should I expect, what problems can happen, what happens after the baby. Okay, and basically these 4 things will answer to you how do I improve my chance for normal delivery and how do I prepare for C-section. Okay, so the manual for today, if before labor, you need to prepare. During labor, we're looking for progress. Okay, there's 4P. And the third thing is if it's difficult labor, we go for plan C. Plan C is C-section. And number 4 is after labor, which is the peaceful time. Okay, so before labor, so you can see this mom, the photo. Can you see the background photo? Okay, the mom is coming in and in labor. Okay, so before labor, the first question is, what should you bring? Do you bring things for the baby? Yes or no? Oh, no answer. Yes, okay. All right. Yes, okay, good. Not sure. Still Jinhee, not sure. Okay. Yes, okay. Second thing is, do you bring things for the mommy? Yes, for both. Okay. All right. Okay, this is where usually in the physical class, all the mothers will hands up. Okay. How about things for the hospital? Do you bring things for the hospital? Okay, what I mean by things for the hospital is usually the deposit money lah. Okay, and then bring your cards, appointment card, and if you have a red book, you must bring the red book. Okay, that is what I mean by things for the hospital. Okay, and do you bring things for the husband? This is a trick question. Bring Maggie for husband. Okay, not so charm lah. The husband can still walk around. Yeah, power bank for husband. Okay, that's a good suggestion. But if you bring power bank, then the husband will be entertained, but the handphone won't be entertaining you. Okay, all right. So actually, mainly is things for baby, things for mommy, things for hospital, and less things for husband, because husband is still mobile. You can just go around. Okay. And if you want the pro tip, you actually can go to baby shop, and when you want to prepare, you just ask them to pack for you everything. And you can actually tell them your budget. All right. If the budget is okay, then they will give the budget that you want to. And let's say when they pack everything, and let's say this the baby shirt, you feel, oh, this one not so nice color, you can change the equal color, equal item lah. Okay. And then for this checklist, you can go to my website under the patient's corner. You will have one checklist. You click on the checklist and you have a full checklist that what you need to bring before the labor. Okay. Right, LSK said bring husband, bring credit card and money. Yeah, that one's for the deposit. Okay, all right. So the next one is before labor. So you can see in this picture, actually labor can come very sudden and sometimes can be very slow. So it's very unexpected. And when you are not prepared, then the baby will deliver at home in the alley or at the car or even at just at the door of the hospital. But this kind of scene is very, very rare so far in our private practice. Okay, so when should you be prepared? Okay, do you prepare yourself when you feel pain? Yes or no? Okay, right. Answer. Oh, everyone is sleeping already. Okay, maybe my internet lags a bit. All right. So the second question is, do you bring when expected due date? Yes or no? Okay. Okay. How about 37 weeks pregnant?
这是讲要生前要准备好吗？
Yeah.
大概有讲。
你什么时候要准备啦？生前。
刚才前这个问题已经讲
Sorry,
去了。
please unmute
要带
yourself.
baby 的东西吗？要带妈咪的东西吗？要带老公的什么东西？
老公不用带啊。
然后还要带医院的什么东西？就
Okay.
有些人讲要带保温杯。
Sorry, I can hear someone talking. Maybe you can unmute yourself. And the last one, sorry, 34 weeks pregnancy. Okay, sorry, I couldn't. This is my second time I cannot host. Okay, all right. Someone unmute yourself. All right. So 34 weeks pregnancy. So, which is the correct time to prepare yourself is basically 34 weeks. Okay. By 34 weeks, when the baby is 2 kilo, it means that the baby is actually safe to deliver. Okay, so at 34 weeks, you must be prepared. Okay, but baby usually will deliver if it's normal at 36 weeks. Okay, 36 weeks is 10% of baby will deliver 36 weeks, and 10% will until the due date, and in between it depends. Okay, but 90% usually will be before the due date because 10% will reach the 40 weeks, which is the expected due date. Okay. Okay. So before labor, so when should you come? Do you come after you have washed your hair, bathed, and eaten your favorite char kway teow? Who will do this? Yes or no? Okay. So Arlene said yes, yes, yes. Okay, most of you guys will yes. Okay, all right. So so actually the answer is no. Okay, no. All right. Okay. Do you come when you have the amniotic fluid leaks? Means 破太水. Okay. All right. Depending on situation. Okay. All right. If you have amniotic fluid leaks, you come immediately. Okay. But you don't need to do like in movie. They drive the car very fast and go to hospital. No need. Okay. You just drive properly. Okay. Because if you drive too fast and you got into accident, then you get to the hospital slower. The amniotic fluid leaks means that you can feel that there's a lot of water coming down, very warm. Okay. That's amniotic fluid leaks. Okay. When it leaks, you come to hospital immediately. Because when it leaks, one of the things that we are very scared of is the cord coming out. If the cord coming out, then the baby may have no oxygen because the cord is the one that carry the oxygen to the baby. So make sure that if it leaks, you come to hospital, but no need to rush. Just normal speed, you come to the hospital. And especially if your baby head is down, then it's okay. But your baby head, if it's up there, then you must come faster. And the mothers need to lie down and put your buttock up. Because when the baby's head is up, sometimes the cord will come down. So that is one of the danger if the baby head is on top, which is called breech presentation. Okay. So do you come when you have regular strong contraction? Yes or no? Yes. Yes. All right. So this is an easy question, okay? So definitely you come when it's a regular strong contraction. And what do you mean by regular strong contraction, okay? Regular strong contraction, it must be regular. So it's like you're a regular patient, you keep on coming regular, okay? So the contraction must come regularly. It cannot be like, or it comes like 3 times 10 minutes, then it stop, then it come back again, then it stop for a long while. Then that's not regular. It must be regular, and it must be 3 times in 10 minutes. And strong means it's so strong that you don't feel like, it's a bit only. No, strong means that it's so strong that you cannot even laugh, you cannot smile. That is strong. You feel the pain, then you come over. All right, unless your previous pregnancy you have very fast delivery, then you come when earlier, okay? When you don't feel strong, you feel a bit regular, you come. Because some people, they have no pain, and when they come to hospital, I check, already 5 cm 6 cm, but they don't have much of pain. This kind of people, they go in labor very happily because they don't feel much pain. So if you are not your first timer, then you watch for regular strong contraction, okay? The next one, do you come when you have vaginal bleeding or show? Okay, can you see down here there's 3 pads. So these pads is where you can see that there's some mucus, okay? So this mucus is called show, okay? So this show is the cervix is like a cylinder. So when the cervix open, in between there's some tissue. This tissue coming out is the show, okay? So do you come when you have show? Yes or no? Okay, the answer is yes, okay? You come when you have show because we want to know whether your cervix is very dilated, okay? And sometimes your cervix, the show, you may mistaken, and it could be actually bleeding, and we need to check your baby heartbeat to make sure the baby is okay, all right? And sometimes, like what I said, some people, they have no strong pain, but when you have the cervix dilated, you the show come in, then when we check, it's really already 3 to 4 cm, okay? And okay, so do you come when you have reduced baby movement? Yes or no? Who say yes? Type yes. So today a lot of typing huh? Okay, so the answer is yes, okay? So how do you know whether you have reduced baby movement, okay? You know you have reduced baby is not count by counting, okay? So in the KK, they will ask you to count from 9 a.m. to 9 p.m. You must mark for 10 times and consider you have normal baby movement. But in UK, the RCOG asks you as a mother to observe, okay? Because you would know, like, usually the baby move how much, then suddenly the move reduce and is considered reduced and you come, okay? But if the baby move a lot, okay, a lot, you don't come, okay? You don't come unless you want me to earn more money, then okay lah, all right? So usually increased baby movement is normal, okay? Because some patient, they told me, or they read from the Facebook, increased baby movement is because the baby got choked and strangled, all these things. No, okay, it's not true. Baby wouldn't strangle the baby itself, okay? And if it's strangled, you will have reduced baby movement, not increased baby movement, okay? All right, so everyone is clear, okay? I'll go to next slide. Okay, so this next slide will be talking about induced labor, induction, tracing, okay? So what do you need to know? Okay, so induction or labor, the best time is when, okay? A lot of times, if you go to a government hospital, they will induce you after your due date, maybe 7 days and 10 days. And some in the private, mostly induced at 40 weeks, okay? 40 weeks means your due date, okay? But the best time to induce, according to a big multi-centered many country trial we call ARRIVE trial, okay? This ARRIVE trial saying that at 39 weeks, if you induce a pregnant lady, it has the lowest baby admission to NICU. Means at that point, if you induce, it's the best for your baby. And second thing, if you induce at 39 weeks, also show that it's the lowest rate to go for Caesarean section. So this is what the big trial, ARRIVE trial, has shown. So in my clinical practice, usually I offer induction at 39 to 40 weeks. So we don't go above the due date. All right. If you go above the due date, there is the placenta too mature, and then your baby may not have sufficient oxygen, sometimes they may not be well. So better to induce in between 39 to 40 weeks. Okay, so if you do not want to have any induction, then you can choose on the due date or any days before the due date, because some people they want to calculate the good days or this thing. Okay, how? Okay, so induction of labor, usually we put in medication called prostin. So this prostin is a hormone called prostaglandin, and it will put in your vagina, okay, at the posterior fornix, means that is below your cervix, and it will stimulate the cervix to open, your opening the neck of the womb to open. Okay, this one will be inserted in the midnight. Okay, usually you come at 12, we insert one, and then the next morning I will check, and normally usually it will open, and once it open we will rupture the membrane, and then we give you something called oxytocin and increase the labor pain, and then you will deliver usually within office hour. All right, so that you don't go until the night time. All right, and is it more painful? A lot of people talk about, or you induce, will it be more painful? Okay, actually personally I would not know, because I didn't go for induction myself. I mean, I'm not a pregnant lady. Okay, but actually, in fact, some people they actually measure the pain for both induction and normal labor. Actually, the pain is almost the same. It's just like Chinese cuisine and fine dining. Okay, if it's an induction, we put in the prostin, is an external hormone. So like Chinese cuisine, all the dish all is there. But fine dining is like slowly one dish, one dish, one dish. But at the end, the total amount of the food is the same. The total amount of the food is the same. Okay? All right. If you have any question, you can just type on the chat box and I'll try to answer it whenever possible. Okay? All right. And okay. So the next question is about this induction or labor. Should you do it or you shouldn't do it? Okay, so it depends on your personal preference. Okay, so in now, because it's a pandemic time, so if let's say you come in labor, means that you have the show, the pain, amniotic fluid leaks, or some of the very severe pain, okay, then we straight away do this rapid test, which is a rapid PCR test. Okay, if you are negative, then you go to labor, you just deliver normally. But if you are positive, you will need to go for Caesarean section with the PPE. PPE is where we all wrap up like bacang like that. Okay, and then we would repeat the RT-PCR, because this RT-PCR will be more accurate. Rapid test will take around 1 to 2 hours to come back for the result, but RT-PCR will need 24 hours, means the next day. So if the next day come back, if it's positive, it's the same thing. You, after Caesarean section, will go to the isolation ward and we'll have PPE. Okay, and then if negative, you go to normal ward. So sometimes we have this what we call as a false positive rapid PCR. So if it's in labor, we cannot prevent this false positive rapid PCR. But the rapid PCR that's positive and then RT-PCR which is negative, it will be very, very rare. Okay, very, very rare. All right. So the second thing is induce. If you induce, the good thing is we can do the most accurate RT-PCR 2 days earlier. So if we do 2 days earlier, we can avoid the false positive rapid PCR test. Okay, and if it's negative, then you go for induction and go for labor. But if it's positive, means that you are a COVID patient, then we would delay the induction. Okay, delay until you are not infectious anymore. Then you no need to go for Caesarean section. You can do induction later on. Okay. All right. There's a question asking, I'm 40 weeks today, but baby head not down enough. Should I try to induce or better go for C-section? Okay. When you're 40 weeks, let's say your baby is okay, you are all right. Whether the head is down enough or not, it have to be induced and the head will come down. And whether does it come down or not, it depends on your labor at that time, does it come down. Okay, this one I will explain further in my further slide, whether the head will come down or not. All right. Okay, so the next next in our menu is the during labor. So you can see this picture. Do you see this picture? All right, can you make out what is this picture? All right, this is actually the baby's head, okay, on the vagina, and usually at this point we call baby's head crowning. Crown is the crown. So you can see this is the crown, okay? All right. Okay. So when you are in labor, what should you expect? Do you expect a private room with toilet? Yes or no? I'll be back to the question. Everyone, hands to the keyboard. Okay, Jamie, right? Yes. Okay, the rest are not hands on the keyboard. Okay, don't know. All right. So in the hospital here that I'm working, yes, all right, you'll be having a private room with toilet, so your husband can stay in, all right? So you'll be examined by midwife and nurse, okay? And then you will have your water bag broken, okay? Means we break the water bag. So when we break the water bag actually does not belong to you, but does not belong to the baby. It's the entity by itself, okay? So when we break the water bag, you won't feel any pain, okay? But because when you go in with the finger here, then you feel a bit of stretchy sensation, but no pain. And some people, they say, hey doctor, why you want to break my water bag? Let it break itself, okay? All right. So usually we don't allow the water bag to break itself. Why? Okay, there's two reasons. One reason is that when we break the water bag, we can see the water inside. If the baby has pass motion or poo inside the womb, then the baby may inhale and then it's not good for the baby. So we can observe whether baby have poo. Second thing, if we break the water bag, your labor will be shortened by 1 hour. That is the reason why we break the water bag. Okay. And you have a CTG machine to the tummy, okay, and the baby, all right. So basically, this CTG is called cardiotocogram. So cardio means heart, toco means the contraction. So we are monitoring your contraction and we are monitoring the baby's heart, okay. Why? Because the contraction will tell us the progress of labor, and the baby heart, we want to see whether the baby is it healthy or not. Is the labor too stressful for the baby? So the baby is inside a room, so the baby is coming out. So this room is keep on contracting. So if the baby is very comfortable, no problem, no distress, then the baby can go through the labor. All right. So this CTG is very important. Okay. All right. And lastly, can you move around the room? Yes or no? What do you all think? Yes. Everyone's still thinking, right? Okay. So in the room during labor, it depends on you whether you will need to depends on you whether you can move around or not. Sometimes because of the pain, you cannot move around. If it's too painful, yes, you cannot move around. But if you want to move around a while, it's okay. But we need to maintain to check the baby's heartbeat. Okay. All right. So the next thing is during labor. So what are the choices of pain relief during labor? Is this the singing by husband? Yes or no? No. Okay, you can try. Next is the massage by husband. All right, sometimes the massage can be okay as well, okay, to reduce some of the pain. And breathing exercise, okay, they will reduce a bit, but not very effective, all right. So last time we used to have this laughing gas, okay, this Antenox. So this laughing gas, now because of pandemic, a lot of this gas come out, so they don't allow, okay. And injection, okay, so injection will reduce 30%. So sometimes if you don't want to have the final one, which is the best epidural, then you can have your injection. But injection is only reduced by 30%, okay? So I'll talk a bit about this epidural, okay? So this epidural, what is it? Basically, they are inserting a small catheter into a backbone, the space we call epidural space. So this space, after that, you inject something to numb the pain for you, okay? And who will do it? Not me, okay? It's the anesthetist, okay? The doctor who reduce your pain, okay? And then what is the benefit, okay? So for epidural, is 99% no cancellation of the pain. So you're so comfortable, you go to labor, wow, very chill. Okay, doctor, I watched 2 movies already, when can I push? Okay, so it's a very good experience because you have almost totally 99% no pain. But of course, 1% sometimes you still have pain, okay? And what is the risk? Okay, actually this epidural will not harm you, okay? Will not harm the baby, and then it won't disturb the labor. The only risk is increased risk of using vacuum. Why? Is because you have no pain. So it's like you have no motivation sometimes to push. For instance, I ask you to climb out, run up Penang Hill, you wouldn't run because you have no motivation. But if I put a tiger and chase you, confirm you run up, okay? So this risk is usually increased, what we call this vacuum, okay? And back pain, okay? So back pains, a lot of people are thinking, doctor, if I put this, sometimes I have back pain, right? In our research show that back pain you have, but only back pain, but usually around 6 months. After 6 months, your back pain is same as people who have no epidural at all. And usually for me, I feel that the back pain is more of a postural, and sometimes because some ladies, you like to hold very heavy bags, okay, that can also cause back pain. And also if you can see the back pain clinic in our back pain clinic with orthopedic, most of them are guys, okay? Why? I mean, why is it guy? Because if you say epidural can cause, why is it guy? Guy don't have epidural and they don't have anything poking into their back, but why they have back pain? So it's more of what you carry, and sometimes because after delivery you carry baby only one side, because I'm familiar with this side, then you have this imbalances and you have back pain. And then you say, oh, because maybe it's an epidural. So it's not the epidural, okay? And also some people say, oh, because I bathe, so jip hong, the wind enter, become pain. No, okay? Epidural doesn't increase your back pain. It just have a back pain increase maybe in the first 6 months. Up that is normal. This is from a large study, okay? And difficult labor, okay? So difficult labor, you can see there's 4 P, powers, okay? The passage, the passenger, and the psych, all right? So basically, these are the 4 P of childbirth, okay? So you can see in this thing, this is the passage. So if it's a small baby, you have a good passage, you can easily go through. If you have an adequate passage, but the baby is big, sometimes very difficult to pass through. So this is something that you need to know. So for instance, this is your second baby, your first baby is very big, then you can go for normal. Then of course, the second one slightly smaller, you can also normal, okay? All right. So, okay, so we talk about difficult labor. So these are the things that if it's difficult, then you will proceed to becoming C-section. First is the power. This power is, we look at the contraction, the power contraction to push the baby out, okay? So if let's say you increase weight gain a lot during labor, so in the fat tissue you have a hormone called leptin, and this leptin will reduce the effect of oxytocin, which is a hormone to make the contraction, the power to push the baby out. So if the power is less, then the baby may not progress and you may go for C-section. And second thing is when the baby head already almost crowning, then you yourself need to push. So if you don't have the power to push, then we may assist with vacuum or forceps. But if your opening is not 10 cm, you don't have the contraction, you can only increase your oxytocin until certain level, and then we need to wait for the contraction. I mean, we need to wait for the os to be 10 cm. Some people, they have only, some ladies, mom, they have 3 cm. They ask, doctor, can you use the vacuum and suck baby out? Cannot. It's not that easy. It's not that simple, okay? Because we need the opening to be open first, then only we can bring the baby out, okay? What I mean by opening is the passage, okay? So the cervix need to dilate. Some people, they have their own cervix which they couldn't dilate, okay? And that one is sometimes because of congenital, or maybe because the baby head is a bit slanted sometimes, then you couldn't dilate the cervix, okay? And this is cervix, okay? Cervix is the neck of the womb, and then it's not the vagina. Because sometimes when the cervix couldn't open, they will ask, doctor, can you just do a cut? Okay, no. If it's a vagina, then we can do a cut, and that cut is the episiotomy cut. Later, I will show a picture. All right. And passenger. So this passenger, if it's too big, of course, you cannot deliver normal. And then, of course, the baby distress, meaning that the baby, when you have a lot of contraction, the baby heartbeat drop, means that baby couldn't stand the stress of labor. So if you couldn't stand the stress of labor, if it continue, then baby will have lack of oxygen. So in this condition, you need to go for Caesarean section. Okay. And second thing is shoulder dystocia. Shoulder dystocia means the baby head is small, but the body is big. So sometimes this is because mostly is because the mother have diabetes. Okay. So at that point, we cannot do C-section, but we will have a maneuver to try to increase the pelvic floor, the pelvic opening, and then we need to maneuver the baby shoulder to come out. Okay, so usually the bigger the baby, the higher the risk. But some baby is small also can have shoulder dystocia because the mom pelvic bone is slightly smaller. All right, but we will look at it and we will see what we can do. And usually we do a maneuver, and it's usually unexpected. But we, the doctors and the midwife, are very well trained in this managing the shoulder dystocia. Okay, and of course the psych. Side means that you are all side up. You want to have normal delivery and you must push. Some people, some mom, they are not side, so they're like, oh, I couldn't push. Then they're not side for the pushing, so they wouldn't push. It's just like you want to run up the Penang Hill. You must have the side, the mentality that I want to run up the hill. Okay, all right. Someone asked, I'm 154 cm, baby now estimate 3.56, consider big to me. Usually we don't see the baby's height. Okay, we need to assess the mom as a whole. So usually I will need to see the mother, everyone, and then see the baby and measure the head, the body, everything. We cannot only based on one measurement. We need to see the overall. Okay, all right. So this is a 4P or difficult labor. Okay. So in one of difficult labor, I talk about episiotomy. Okay, some people say they can hear part. Okay, so all right, my Zoom has limited 40 minutes. So here they show that less than 1 minute. I'm not sure whether they'll extend for me. If let's say this one have logged out, I will put in a new code in the website, and then later we'll come back in the new session. Okay, I mean I will just put in a new code in our website if the Zoom does not extend for me. All right, so this episiotomy is a cut down below. All right, and then it prevent bad tears. Okay, no, not really prevent bad tears, but it prevent a tear down to your anus. Okay, because it will harm the bowel. Okay, if you go to the anus. And then will it speed up the delivery? No. Okay, unless sometimes it impedes, means that the baby head come down but it doesn't go down, then we will need to cut and to speed up. Okay, so the episiotomy is actually not routinely done. Okay, we only do the episiotomy if let's say that the baby's head is keep on bobbing down but not coming up, then we need to do the episiotomy. If it's not bobbing down, means it's not preventing the baby from coming out, then usually we just let the baby come out by itself, like what you have saw just now in the first picture, the crowning of the baby's head. Okay, all right. Okay, someone asked how to avoid episiotomy. Okay, so usually we cannot actually avoid episiotomy. Okay, it's just that episiotomy is at that time really needed for the baby, then we will do it. Okay, and some people, they actually in Australia, they have we call a vaginal dilator. They will put in your vagina and then they will expand a bit, and make your vagina more stretchable. Then you can avoid the tear and avoid episiotomy. Okay, so you cannot 100% avoid, but you can actually reduce the episiotomy. Okay, all right. So does this answer your question, CY? All right. And then we will do it during the forceps and vacuum. Okay, why? Is because in the vagina, the space is very small. So if you want to put in a forceps or want to put in the vacuum cup, you couldn't put it. So usually we need to do episiotomy, and then only we can put in the cup, and then we can safely put at the area that is correct. We call this flexion point of the baby, and then we can help to pull out the baby. Okay, in vacuum, we do not actually pull the baby without your effort. You still need to have your effort, only we can pull out. So usually I will tell the mom, it's 50%, 50%. You push 50%, I will pull 50%, and together the baby will come out. All right. Okay. So we come to the last menu for today, which is after the labor. So you can see it's a very emotional time. It's just like you running up to Penang Hill, you reach the Penang Hill, you're so tired, and this is the after labor scene. Okay. So what to expect after the labor? Okay. Tired mother, yes or no? Of course, all right. So you have a tired mother, all right. Crying baby, do you have a crying baby? Yes. Mostly the baby when come out will cry, okay. If the baby do not cry, means the baby may have some oxygen reduced when deliver, okay. So the baby must cry, okay. But after the baby cry for a while, it will stop crying and just sleep, okay. Because sometimes maybe it's a new mother or new father, you hear baby crying, then baby stop crying, then be worried. They ask me, doctor, the baby okay not? Why no more crying? Okay. Once the baby come out, it cry, then it become calm, then you will stop crying. It's not that the baby must keep crying, okay. Of course, when it's keep crying, then the baby is not in distress, the mom will be in distress sometimes, okay. Then the next one will be tired doctor and nurses. Yes, sometimes the doctor and nurses will be tired, okay. And there'll be a crying delivery suit. What do you mean by crying? It means that after the baby delivered, you can see that there's a lot of blood, and even with the placenta separated away, there'll be a lot of blood, okay. So these are amount of blood. So usually this blood amount, we say, cannot be more than 500 cc. If it's more than 500, we consider postpartum hemorrhage, means excessive bleeding, okay. So usually we need to observe, and there's few things that we need to look at. Mainly the 80% is when the womb doesn't contract, okay. The womb got tired, doesn't contract, and once it doesn't contract, then it will bleeding, because in the womb the vessels is in between the muscle, okay. So when it contract, the vessel will be cut off and it won't bleed. But when it doesn't contract, it's relaxed like this, then the vessel will have the bleeding, keep on bleeding. So usually we need to, the midwife will massage you here, okay. This is where we want to try to make the womb to contract, all right. And the second thing is because a lot of tears, then we need to suture. So if we in the labor room we couldn't suture, then we need to bring to the operation theater to suture with a better lighting, because labor room we have a very huge light, but in the OT it's like a bigger light which is more focused, and we can see each angle of the vagina and we suture properly, okay. But that is very rare to have a very uncommon to have very severe tear, okay. And usually severe tear is when you have a big baby, okay. So sometimes we anticipate this will happen, and then we have to go and go by ears, all right, okay. And lastly, you have happy husband, family, friends, social media friends, start to update your Facebook, all these things, okay. So for the current delivery suit that I'm working, so we don't allow husband to take video or photo of you delivering, okay. But after the baby have delivered, then you put in the incubator, baby is already stable, you are stable, then you can take photo, no problem, okay. But we don't want to have any photo during delivery, because it's like, it's not nice now, okay. All right. And then it's like sometimes you will hinder in our job, and sometimes we have contamination, all these things, all right. So preferably there's no photo taking during the delivery itself, but after that, straight after that, once the baby is okay, baby is very comfortable, we allow you to take photo, okay. Is the husband allowed to go in labor room? Yes, okay. If you follow me, the first slide that I show, there is a private delivery suite with your own toilet. So our only concern is the husband must stay in the labor room. Don't come out, go in, come out, go in, come out, go in. Why? It's because there are other ladies in other room as well. We don't want you to go into the wrong room and see the wrong things. Okay, right? So hopefully if you are in the labor room with your wife, you must be inside the labor room the whole time. Bring your food, bring your this charger or this thing, okay, a power bank. Okay, Jenny Wong is sweating. All right, so all right, the next one is let's say you couldn't go through the labor, means that you have problem with the power or passenger passage, okay, or the psych, then you go for cesarean section. Okay, this is what I call it plan C, okay, which is a cesarean section. So cesarean section can be two, either emergency or elective. Emergency is when you go through labor and then you have the 4Ps problem and then you need to go for emergency. Elective is you already know that you cannot go into labor because the risk is very high. Then we arrange one day for the cesarean section. So the pre-op means before the operation, we have some medication we'll give you to prevent regurg, okay? And you also have to fast. This fasting is so to prevent the fluid from your gastric, which is your stomach, to go into your lungs. So normally we need to fast around 4 to 6 hours, mainly 6 hours is the best, okay? So it means that if we want to anticipate emergency cesarean section, when you go into labor, you are not supposed to eat anything. You can only drink clear water, and we will give you some of the glucose through the trips, okay? And you won't starve, okay? Most of patients, they go through labor, they won't starve, and they will still have energy at the end of the labor to push, okay? So this fasting is very important, all right? Second thing is intra-op, means during the cesarean section. I'm just roughly telling you. So your anesthesia, I mean your pain relief is still, we call spinal anesthesia. It's some sort like epidural, but it's go into a different space, which is spinal space, and it doesn't put some catheter inside. It just put one poke and then insert the pain relief. It will last for 6 hours, and then you have a drape over in front. Okay, you won't see the surgery, and then after surgery you will hear baby cry out. Then later we dry the baby and the baby will come to your side and you will kiss the baby. And then after kissing the baby, it will show you the genitals. Okay, the genitals. Okay, see whether it's boy or girl. So it's your job as a mother doing cesarean section to say, this is a boy, this is a girl, because this is the SOP. You need to write down. Okay, make sure that you identify the gender of the baby. All right. And then post-op, after the surgery done, you will be observed in the operation theater observation bay for maybe around 30 minutes to 1 hour, depends on your stability, and then only you go back to the ward. All right. All right. So, okay, before I go over, I just answer a question from Jane Tan. Okay. Any tips to start contraction? Baby seems like too comfort in my womb. Okay. So there's no tips. Normally for my patient at around 37, 38 weeks, I will do a vaginal examination and I will stimulate the cervix. We call this as sweep and stretch. Okay, this sweep and stretch is not a new technology, because some lady, they never heard before. They say, oh doctor, is it a new technology? No, it's not new technology. Okay, basically I'm stimulating the cervix to produce the prostaglandin, which is similar to prostin but it's natural. Okay, and it will reduce the need for induction with the prostin by 70%. This is how we start the contraction. Okay, and then some people, if you read some webs or some website, they want to sensationalize. They say, oh, you can have sex to start the contraction. Okay, but they have already done a studies. You have prostaglandin in the sperm produced by during sex, okay? But the amount of prostaglandin for a sperm to cause to be same as a one small tablet of this prostin is one whole bucket of sperm to produce one prostaglandin, okay? So unlikely your husband to have sex to produce one bucket of sperm to trigger your contraction. So you can have sex to try to stimulate a bit, but you won't have one bucket of sperm. Okay, all right. So next, I would need to, okay. So after the baby had delivered, then we go for a neonatal baby examination, okay. Actually, the baby, when first week of the baby, we don't call this baby, we call neonates, okay. Then it become mean older, become toddler and infant. So we got different term for different age of the baby, okay. And this is a baby examination usually by the kids doctor, okay. So the first question, this is a 5 top question about baby examination. Can I choose my pediatrician? The answer in here hospital is yes, okay. We got 3 very exceptional pediatrician, and you can choose anyone that you like, okay. But it depends on your time of delivery. Let's say if your time of delivery is at midnight or during after hours, then the on-call pediatrician will see your baby first, then we'll pass over the care to your peds of choice the next day or anytime your own peds have come to take care of the baby, okay. Second thing is, when will my baby be examined by peds? If your baby is very comfortable, very healthy, the pediatrician will come and examine as soon as possible, okay. Unless the baby, before the delivery, we can see from the CTG, the cardiotocogram, the baby had distress or this thing, then the pediatrician will come and stand by for the delivery, okay. Okay, this answer are provided by Dr. Siti, okay. All right. And what is being examined, okay? So basically, the baby will be checked from the top to the toe to see the general health and to see whether the baby have any dysmorphism, okay? Dysmorphism is like whether baby look like those syndromic baby like Down syndrome or any other syndrome. And then also we check for any congenital abnormalities, mean abnormal, maybe have hole in the heart or there's any small cleft or anything like that, all right. So this is what the baby will be examined, okay. The next question is, does it hurt my baby to be examined? No, okay. The examination doesn't hurt your baby. Sometimes you can see the baby being like let down a bit, and you look at the baby whole open, and this is to test the reflex, okay. We call Morrow's reflex. It doesn't hurt your baby at all, okay. And then the last question is, what are the top 3 most common abnormalities? All right. So the Dosity was saying that it depends on the gestation. It means how big the baby and the timeline. But the most common 2 is usually jaundice, means a yellowish baby. Okay. Okay. Yellow skin, yellow sclera, the eyes. Okay. And sometimes the baby maybe too small or insufficient milk, it become very jitter, okay, because of low sugar, all right, low blood sugar, okay, all right. And then of course the baby or the neonate, we go in our package in this hospital, we go for this neonatal hearing test under this audiology department, these 3 exceptional pretty lady, okay. So the test is called auto acoustic emission system. I don't know why the initial is DPOAE, okay. So there's a top 5 question, okay. First is, why do you want to test for neonatal hearing test? Is because this, we call this congenital deafness, is a very, deaf silent, okay, it's a silent disease, okay. It happens in 3 every 1,000 baby, 3 of them will affected. So if the baby is deaf, it will also impact the speech as well, okay. And then when do you test this? This is usually tested on the first few days of baby deliver before the baby is being discharged, okay. How the test is being done, okay, it's very simple. They will put a very small mic on the earphone, on the ear, sorry, it's a microphone on the ear, and then there'll be a soft click, very soft click, and this click will go into the eardrum and it will produce echo response, and this echo response will be will receive by the microphone, okay. So it will detect whether the baby hearing, means the baby ear, the inside of the ear structure is normal or not normal, okay. And then someone will ask, wow, does it hurt my baby? No, okay, because it won't hurt. It's just a very small vibration. It's not really the song, the concert loud noise, okay? No, just a small click, and then it come back and you catch the echo, okay? And the last one is, what the result will I get, okay? So basically, it sometimes will produce a result as does not pass, okay? This one does not pass is because the baby sometimes move a lot, because this test must be done when the baby is sleeping, all right? Because when it move a lot, the echo become different, all right? And then you need to repeat the test. And if the test result come back as normal, then we know that the baby does not have any congenital, means is not born deaf, all right? But the problem may also develop later, because if the baby get infection, got sickness, got some medication that can affect the ear, then the hearing test need to be retested, okay? In the hospital, current goal is to test by 3rd month and then to treat by 6 months to make sure that baby will grow up and have adequate help if the deafness is detected early. All right, okay. Okay, so all right, so we come to the last slide. Any last question? Okay, any question? Yes, no, too afraid to ask, you can type. Okay, last time is a physical class, usually they will hands up, or you are still sleeping, you can continue sleeping. Okay, all right. So Ji Hong asks, any ways to reduce jaundice? Okay, so this jaundice, you must know the the basis of this jaundice. Jaundice is basically the baby liver is the breakdown of the blood cells. It will cause the jaundice substance or the yellowish, okay, the bilirubin, okay. So when the baby is the liver still immature, then it could not break down fast enough, then it cannot process fast enough, then the yellowish will accumulate. So to reduce the jaundice, usually what you need is actually to feed the baby more, okay, to feed the baby more. And some people, they say, oh, you go and shine to the UV or this thing, but for the pediatric, usually they don't encourage all this shining of UV, because sometimes baby will get hypothermia, means get cold, because sometimes you just baby naked on the shine, but actually the weather is cold. And then the UV is ultraviolet, is different from infrared. Ultraviolet is when you have very early sun, which is not hot, and then the infrared is when it's hot. Okay, when it's too hot, then maybe you burn the baby dehydrated. If it's too cold, the baby may get cold. So usually the best thing is to give baby more feeding. All right, breast milk, of course, is the best. Okay, if let's say you need to give bottle milk, you can put more water, but don't give pure water. Okay, a lot of people still give pure water. By right, pure water is not supposed to give to baby, because it may cause some the we call this electrolyte, the salt in the blood become abnormal, and then you can cause the heart to stop. All right, so don't give pure water to the baby, you mix with some milk powder. All right, okay. So all right, so the next question is from Yuan. More exercise will help for easy delivery. When is the best time we can start exercise? Okay, yes, more exercise will help easy delivery. Why? Just like I mentioned just now, if you exercise, your weight gain may not increase that much, so your fat tissue, the leptin will be less, then you have more oxytocin, you're easier to contract. And of course, when you push that time, you need some strength as well. So when you have more exercise, your pushing power is more. Okay, when is the best time we can start exercise? Actually, you can do exercise anytime since you confirm pregnant until you deliver. Just that there's few exercise you cannot do. First is contact sport like rugby, balance sport. Okay, you can do yoga, but make sure your 2 feet is on the ground. Don't have yoga with 1 feet or this thing which is balanced. Okay, and you don't over exert yourself until that you're so exhausted, you're so dehydrated. So these 3 rules of exercise in pregnancy you must adhere to. Okay. Jamie Wong, Can we see the baby face during detailed scan? All right, this is a question for antenatal class. I mean the antenatal follow-up. Yes, you can see baby face. All right, but whether you are experienced to figure out the face is another thing. All right, to figure out the face, you need a 3D reconstruction, which is we need a 3D scan. That one will be done in the radiology department. Okay. So Yi Su Min asks, I walk and squat every day, but why baby still don't want come down? This come down means that the baby come down to the pelvic floor, okay? Actually, the baby come up pelvic floor, it depends on contraction. Your walk and squat is for you to push when the baby is, I mean, the opening of the door, I mean, the opening of the womb is 10 cm. At that point, also you don't push yet. You mean the baby have to come down first, then only you push. When it's 10 cm, we consider this as a active phase of labor, okay? Means that this one is because stage 2, okay, when the mom will push. But in this phase, actually they have passive and active. Passive means the contraction will push your baby head down. Then when it's around like halfway, then you start pushing. That is when you need to use your power of, I mean, your muscle power push, okay? All right. Any chance can still natural deliver for breech baby? Okay, so for breech baby, the babies, okay, for the baby usually look at three diameter: the biparietal, the head here, the biacromial, the shoulder, and bitrochanteric, the hips. Okay, so usually the head is bigger than the hips. So if you are breech, means that the baby head is on top and the bottom is small. So usually at that point, the danger is that the baby hip come down, shoulder come down, but the head is stuck. So when the baby head is stuck, the baby may not have enough oxygen, and they may have have a danger for the baby to suffocate. Okay, so usually for breech delivery for natural, usually is for second or third pregnancy, and we need to look at the size of the baby, and then whether the baby head will be entrapped. We call this head entrapment. Is very unpredictable. So if let's say you are first baby, and then we usually would suggest better to go for Caesarean section because it's safer. All right. And if you want natural delivery, the second thing is maybe we can at 36 week turn the baby head down. All right. And then we call this external cephalic version. And if you can turn the baby head down, then you can go for natural delivery. All right. Okay. So, okay. Wow. Okay. So the Zoom remind me again, the meeting will end in 10 minutes. my first meeting, they actually extend beyond the 40 minutes limit. That's why today I'm so chill. I try to put in more things, but then it got cut off. But now it doesn't cut off. So the second class, it actually cut off me. Okay. So Arlene Chan asks, if water breaks, can still shower before coming to hospital? If your baby is not breached, your head is below, you can take a very short shower, okay? Then you come to hospital, maybe 5 minutes or 10 minutes shower. You don't, take your time, too late, right? Okay, you can still take shower before you come, but it depends on your contraction actually, because when your water bag broke, then your contraction will be very strong. So if the contraction very strong, then you don't bathe and quickly come. But if you don't contraction, you just break, you just quickly have a shower and you come. Because if your contraction is very strong, then you deliver in your bathroom. All right. Okay. All right. So, any more questions? If you want to ask through the speech, then you can unmute I will unmute you. Yeah. Then you can ask, or else you can just type it here. If you want to ask question, you can hands up. Then you can unmute yourself, right? Okay, we got 8 more minutes. If no more questions, then we will this session to end. The next session, I'm not sure when yet, because the next session I will need to recruit a dietitian and a physiotherapist and maybe a yoga teacher to teach about pregnancy, some of the posture, pelvic floor exercise, and what other diets, okay, that needed too. Yeah, maybe we can see whether any of my patients is a physiotherapist. I want to help share as well. Okay, so everyone clear? Okay, thank you, doctor. Looking forward. All right. Okay, so we close the session for today. All right. Kamsia. Okay. Thank you everyone for coming. All right. Have a good belated mooncake festival. Just remember, one mooncake is equal to 6 pieces of fried chicken. Okay. So make sure you control your weight control. Then you have a good label as well. All right. Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.